Good evening and welcome to our COVID-19 update. I'm Ladi Akiriduluale. Here are the highlights at this hour. Almost 1 million people put at risk of death from HIV and AIDS by treatment interruptions due to the COVID-19 pandemic. World Bank approves $12 billion to developing countries for COVID-19 vaccines, tests, and treatments. And France declares a state of emergency in response to spike in cases of COVID-19. We'll begin our stories this evening from Abuja, where the forced national lockdown enabled by the COVID-19 pandemic has put about 900,000 persons living with HIV and AIDS at risk of dying in sub-Saharan Africa following the interruptions in HIV treatment. At the presentation of the HIV quarterly fact sheet, the Director General of the National Agency for the Control of AIDS, Dr. Gambo Aliu, revealed that the antiretroviral therapy dropped by 45.4% as of April 2020. However, Dr. Aliu boasts that about 30% of COVID tests are being conducted in HIV labs across Nigeria.
Nigeria is desperately trying to control the spread of the COVID-19 pandemic, but that is taking its toll on the efforts to curtail the spread of the HIV and AIDS. Nearly 300 confirmed cases are reported daily in this hospital alone, mostly women, snowballing into an average of 1.8 million Nigerians currently living with the virus, according to a 2018 survey by the National Agency for the Control of AIDS. In recent years, the agency might not have achieved phenomenal progress in controlling person-to-person transmission or the provision of antiretroviral drugs, but it boasts of growing infrastructure that has become very useful for increased testing for COVID-19.
I'm yet to get information about the staff that are involved within the agency. All I know is that there has been some resistance of recent, and we have seen some publications and we have received some petitions. But internally, we are looking inward to see, if we have leakage, where are those leakages taking place and how can we prevent that leakage?
In line with efforts to achieve the twin issues of control and sustainability, NACA reveals plans to set a trust fund in order to boost supply of drugs, as well as tackle complicity among staff in the alleged antiretroviral drug fraud.
The machines that are used to test for this virus are the same. The only thing is the reagent that differs. What we did was during the day we test for HIV, at night we test for COVID. And where this infrastructure is not available at the time the COVID hit, Nigeria wouldn't have had the opportunity to hit the ground running.
In spite of a $6.2 billion investment between 2005 and 2018, much of it from foreign donors, the agency is ambitiously aiming for 75 billion naira annually to empower the agency in the treatment of at least 1.5 million Nigerians for life. Gloria Umezuke, Channels Television News.
Meanwhile, the World Bank says it has approved $12 billion for developing countries to purchase and dispense COVID-19 vaccines, tests, and treatments. The money, which targets vaccination of up to 1 billion people, will be an addition to the bank's COVID-19 emergency response programs that are already reaching 111 countries. In a statement by the Bretton Woods Institution, the envelope is part of a World Bank Group package of up to $160 billion through June of 2021 to aid developing countries to fight the COVID-19 outbreak. This financing package helps signal to the research and pharmaceutical industries that citizens in developing countries also need access to safe and effective COVID-19 vaccines. It is also expected to provide financing and technical support so that developing countries can prepare for deploying vaccines at scale in coordination with international partners in implementing the program. And the World Bank is expected to support multilateral efforts currently led by the WHO and COVAX. The Niger State government has commenced collection of samples from across the 15 local government areas where cases of COVID-19 have been recorded. Also, the state government now has its own molecular laboratory where testing can be done. Emperor Simon has more on the COVID-19 update from Niger State.
The report available to us from the State Emergency Operations Center here in Mina shows that Niger State currently has a total of 262 confirmed positive cases of COVID-19, and the death toll still stands at 12. The state government has, however, rolled out mechanism for collection of samples, particularly in the local government areas where cases of COVID-19 have been recorded. The good news is that the state no longer has to wait on NCDC to screen some of these samples, because it currently has its own molecular laboratory where samples are taken to and they are being tested. We also know that schools have resumed, and the State Ministry of Education is not resting on its oars in ensuring safety in the schools. It has commenced distribution of safety equipment to principals from various schools across the state.
I would like to use this opportunity to thank the state government through the commissioner for the assistance given to us to make sure that the issue of COVID-19 is properly taken care of, not only in local government, even in the state as a whole.
This effort from the state government, I think the sky is not just the limit, and I believe this is just the beginning.
But there are still challenges in ensuring compliance among the students, where we see students gather in cluster and not respecting or regarding the protocol of physical distancing. So the state government and the school authority have a role to play in drumming into the ears of the students the need for them to abide by the safety protocols. That's the update from Niger State. Emperor Simon for COVID-19 updates.
Thank you, Simon Emperor. Moving on to Yobe State, where the federal government's unity schools have resumed academic activities in strict compliance with COVID-19 protocols by both teachers and students. Channels Television visited the federal government Girls College Potiskum and Buninyadi, which indicate that over 80% of the students have reported to the schools.
Schools across Nigeria were shut for 6 months as a result of the COVID-19 pandemic. It's now a cheery moment for secondary school students as the federal government gives the green light for the reopening of unity schools. At Federal Government Girls College, Potiskum, Yobe State, all NCDC protocols such as temperature checks, hand washing and use of sanitizers are strictly observed. For the students, it's a huge relief to be back in school.
Well, it was bored to stay at home seriously because there was nothing to do. We're just at home for almost like 6 months. Well, we are really happy because we believe that since school have resumed, our education will continue.
The school authorities give a reassurance that all necessary requirements for the children's safety have been put in place.
Long before now, we have been anticipating their coming. And before now, most of us, including our teachers, we have been rubbing minds to get ourselves prepared to welcome our students. And thank God, close to 80% of our students are back. We are fully prepared.
The Federal Government College, Buninyadi, which was attacked by Boko Haram insurgents even before the pandemic, has come alive once again, preparing to receive its students who have been temporarily relocated to FGGC Potiskum to avoid a setback in their studies.
In Cross River State, students and staff of the Federal Government Girls College in Calabar have also resumed for full commencement of academic activities. The school authorities revealed that adequate provisions are in place for the safety of the workers as well as the students.
Early preparations leads to good results. That can describe the actions taken by the Cross River State government before opening its doors to students. The Federal Government Girls' College Calabar, established 47 years ago, joined other federal secondary institutions in Nigeria for resumption. An all-girls institution established in the heart of Cross River State disallows those without safety gears from entry. After temperature checks at the entrance, basins have been fixed for students to wash hands before joining others. Inside the compound, students are well spaced out, taking instructions from their teachers.
When you were entering, you saw the notice, no mask, no entry. All students are meant to wear masks, not only the students, entire college community, the teachers, the non-teaching staff, even visitors. If you don't wear your mask, you don't come in. And we observe social distance. Usually, we normally have our assembly in this pavilion, but because of the times that we are in now, that's why they are having the assembly here, so that we can observe all the COVID-19 protocols.
The chief nursing officer of the college explains that all that's needed has been provided for the safety of staff and students.
We have our isolation center ready in case of emergency because nobody knows. We have sensitized our students, even our parents, online before the resumption, and we have put in, we have our infrared thermometer at the gate. Before you enter, you are checked. Even when you are not a staff, even when you are coming in for a visit, we check you before you now enter. You are not allowed to enter into the gate. And then for students also the same thing, and they are advised to bring along with them their face mask and then their face shield. And they have been told what to do for us to stay safe.
As they settle down in this environment close to nature, it's expected that safety should at all times be the watchword amongst the students.
In Ondo State, following the closure of schools on March the 20th owing to COVID-19, the state government says it is set to reopen the schools now for academic activities. But with the pandemic still on rampage, the state government has also released guidelines for the reopening of schools. They were announced by the State's Ministry of Education, Science and Technology during a meeting with the executive of All Nigeria Conference of Principals of Secondary Schools in Akure. The Education Ministry's Permanent Secretary, Mr. Akin Ashanio, explained that the meeting was called with a view to involving stakeholders within the education sector in the drive to reopen the schools. According to him, under the new arrangements, schools will resume at 8 and closed by 2 from Mondays to Fridays, and the class seating arrangements will also be scattered in compliance with COVID-19 protocols. All curricular activities in federal government-controlled schools in Plateau, Anambra and Kaduna State are now in full swing, while those managing students at the Kaduna schools seem laid back in enforcing the compliance of safety protocols. Others insist safety is priority in their operations.
Federal Government College in Jos, Plateau State in Nigeria's north-central region is one of the 104 unity schools which spread across the 36 states of the country and the Federal Capital Territory. Students and teachers gather on the school assembly grounds for the first time in 7 months after the COVID-19 pandemic forced the closure of schools nationwide.
The school has done a lot to make sure that the students and the teachers alike comply strictly to the COVID-19 protocols. And we are very optimistic that we will ensure compliance. Before then, I think before even the coming of the students, before the coming of SS3, SS3 they resumed because of their exam before other students. Before then, I think the entire college was fumigated, and also we made provision for an isolation center for both students and teachers.
Meanwhile, returning students of the Federal Science and Technical College, Awka, the Anambra State capital in the southeast, are first subjected to COVID-19 checks before being assigned to classes, as teachers are on hand to ensure strict compliance to safety measures. Although teachers declined to make comments, Some parents speak on the enthusiasm of students to get back to their classes.
I must confess that I'm very happy that today the students are returning back to school after 6 months or more of staying at home. It has not been easy, both for the parents and for the students. For example, my boy has been crying. But this morning as he woke up, he was so excited. He wanted to come here around 6 o'clock to tell you how excited he was. We are the ones calming him down to relax. So his excitement for both the parents and the students.
It wasn't easy. They were all through in the house, burning data because of online lesson. It wasn't easy.
Back in the north, the Federal Government College in Malali, Kaduna State also welcomes back students to academic activities. Although the school management prevents our crew from taking shots inside the premises, we capture some activities such as the use of infrared thermometers to check the temperature of teachers and students at the gate as they file into the premises.
Away from schools reopening to news about small and medium enterprises, where the Development Agency of Nigeria, set up for that purpose, says over 35,000 businessmen and women in Kano State will benefit from its Micro, Small and Medium Enterprises Survival Fund, which is targeted at 333,000 MSMEs across the Federation in the wake of COVID-19. The Director General of SMEDEN, Dr. Diko Rada, said this during a town hall meeting held in Kano City. Dr. Rada explained that Kano stands to benefit in all three categories of the MSME Survival Fund under the federal government's Economic Sustainability Plan.
COVID-19 pandemic, a global disaster which has affected the economy of most countries and businesses of individuals across board.
Zonal coordinators.
In that regard, this event is, however, timely, an intervention for the continuous survival of small and medium-scale enterprises in Kano State. These entrepreneurs, which include leaders of various trade and business associations, artisans, and those in the transport sector, and even women trade groups, have come from far and near. They are here to enroll for the federal government take-up scheme for Nigeria's small and medium-scale businesses as succor for business owners in the era of COVID-19.
Also created this stakeholders engagement and discussions, which we are doing today in Kano, in order to sensitize the leaders of this business and trade associations to go back and sensitize their leaders. And we are working in conjunction with the state government focal person, and the essence of involving the state government is to make wider sensitization and awareness campaign within their subject in the local areas so that nobody will be left unattended.
The host further explains that the forum will also assist in addressing some of their challenges.
It's being chaired by the Honorable Minister of State, Trade and Investment, and it is a very quite interesting meeting because we are getting feedback directly from the stakeholders, and we are getting questions and then their comments and their view on all the programs rolled out by the federal government. And we are going to take this feedback back to the steering committee, and we'll be able to make sure that we address some of the issues addressed by the unions and the leaders, and to make sure that Nigerians benefit from this laudable program and initiative of the Federal Republic of Nigeria under the leadership of Muhammadu Buhari.
As these leaders are enlightened to further educate their members, residents can only hope that this gesture by the government trickles down to the common businessman.
Coming up after the break on our COVID-19 update, we'll bring you the latest figures on the NCDC scoreboard for COVID-19 in Nigeria. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. The Nigeria Center for Disease Control, the NCDC, has confirmed 225 new cases of COVID-19 in 10 states and the Federal Capital Territory, bringing the total confirmed COVID-19 infections in Nigeria to 60,655. Lagos, the FCT, and Oyo are each managing more than 700 cases. Lagos, in particular, has over 4,000 on admission. One death was recorded as a result of COVID-19 complications in the last 24 hours, leaving the fatality toll at 1,116. The number of recoveries has moved up to 52,006 patients. Yesterday, the Deputy Incident Commander from the NCDC said 600 local governments of the 774 have recorded at least one case of COVID-19. 72% of cases are still of unknown exposure, while it has expanded testing to over 70 labs with capacity to test 10,000 samples a day. Let's talk now to Dr. Blossom Madra-Fokwa, who's a public health physician. She joins us via Skype from Victor Island. Good evening, Doc. Thank you for your time. Welcome to the program.
Good evening. Thank you so much for having me.
I will start with you the same way I've started with everybody else who is a medical expert who has been on the show this week. Are you satisfied with the opening procedures for the schools, particularly those with boarding facilities at the federal level as they reopened this week?
Okay, we know that protocols have been laid down, but we see that in practice, there still needs to be, we still have a long way to go. So we have, I mean, on paper, we have all the things that we need to do, the social distancing, the regular hand washing, everything has been spelled out, mandatory face covering wearing. But we have found out that actually in practice, there is a wide gap, and that is the gap that we need to completely narrow if we want to stem transmission of this virus.
Are you really worried about that? Because most of the time what we hear is that the young ones are not really susceptible to this, that they may get it, but they can act only as vectors to more vulnerable groups, that they themselves are unlikely to manifest symptoms or be very badly affected by it.
Okay, so you've actually touched on a very salient point, because the issue is not the young people, because the case fatality rate among young people, it's like something like 0.01%. So we're not worried that we're going to lose a lot of young people. The issue is young people are mobile, they move around, and usually we find out that a lot of them have asymptomatic infection or really mild infection. What does that mean? That means you can be sick and you're moving around. So when you're moving around, you're everywhere. The problem now is when they transmit it to their parents or their grandparents, elderly aunties and uncles who have pre-existing conditions, and those individuals could actually lose their lives because of these young people. So that is the big problem that we're trying to tackle when we put these protocols in place for our young people.
They do, I've heard it said that they will be living in more or less like a bubble, being in boarding houses, given the fact that once they go in, if they don't have the infection going in, the chances are very limited that they will get it if all of them started off by being clean. Where do you stand on that?
Okay, so let's remember, because most of us went to boarding school. So let's remember, you have a house mistress who is probably in her 50s or 60s, who doesn't live in the boarding school with you. So she goes in and she comes out. She interacts with the outside world. You have your teachers, you have your principal, you have the people that clean the schools. So these individuals go in and they go out. A lot of them are elderly, have pre-existing conditions, and interact with other people that are elderly and have pre-existing conditions. So let's not think only about these students. Let's also think about the adults that work with them. So these are the things that we need to actually bear in mind when we're opening schools and we're putting all these protocols in place.
The issue of testing, of course, has also been brought to the fore by this particular action, the reopening of schools. I did mention the issue of the bubble, but the bubble can only exist if they were tested before going in and everybody is clean.
Exactly.
On a broader level, we're not doing that. So would you think it's viable for us to be doing that for these younger ones, this particular group of people?
I mean, obviously, even within your question, you know that it's not going to be feasible. Do we have the capacity to do that? Of course, we do not have the capacity to do that. So that's why these other public health protocols that have been proven to work have to be adhered to as strictly as possible, because we know that we don't have the capacity to do testing. Like I know places like in the US, some of the colleges, they do weekly testing. We don't have the capability to do that. So we need to stress these other public health mitigating strategies that actually work. We need to make sure that we implement them. We need to make sure that they're adhered to.
Let's take it from that level. Some of the states are now ramping up their testing. Every state at least has one lab now. But
yes,
brings back the hairy chestnut in the fire there, the issue of people not presenting themselves for these tests.
Okay, it's interesting that you ask this question, because just last week I was at a testing center, and I can tell you I was shocked, because the staff that worked there, they said for the past 2 weeks, no one had presented for testing. Like, basically, they did nothing. And I couldn't believe it. And I said, so what happened? So I actually had to go back on a day they said, oh, we're going to have some people come for testing. So I went back on that particular day, and guess how many people showed up for testing? 3 people. And one person had just come back from abroad, and obviously, once you come back from abroad, you have to do testing before you can get your passport from immigration. One other person was going for eye surgery and had to get a negative test before her surgery. Some other person had some other surgery and had to get a negative test. In fact, the 4th person was one of my colleagues who said, well, I'm just going to be the 4th person. Let's just make it 4. She doesn't even have, not like she's sick or anything. So it's actually shocking. People are not presenting themselves for testing. So that is actually something that we need to worry about, because we have a lot of people with mild symptoms, people that are asymptomatic, walking around and just going about their business transmitting the virus.
Something else that went by with not too much notice is the fact that it's now been agreed that places like gyms and other such close contact areas, which had been locked down for most of this time, have now reopened.
Yes. Yes. Okay. I'm so glad you raised that up. I'm a fitness instructor, and I can tell you that the gyms, I mean, number one, they're enclosed spaces. Number 2, there's a lot of contact. You're picking up a dumbbell, someone, and dropping it. Someone else is picking it up. You're using this equipment. You're using that equipment. There's a lot. There are so many opportunities for transmission. So my advice for anyone that will be going to a gym is you need to be extremely careful. You make sure before you touch any equipment, make sure you have your cleaning solution and make sure you clean it yourself. Honestly, people need to be careful, because this it's one of the sources of transmission of this. I'm a fitness instructor, but to be honest with you, I'm just doing my classes virtually. I'm actually not going to an enclosed gym for now. So my advice to people is you need to be extremely, extremely careful when you walk into a gym.
That brings the other issue, which is one of general compliance. So except the people going to the gyms possibly are a very different set of people from the general population. And that brings me to the question, do you think there's something genetic, perhaps something in our diets or something that has made all the dire predictions about what would happen in Nigeria or on the African continent as a wider picture not happen? I mean, there are some parts of the world where they are getting a third wave now, but it doesn't seem as if Africa has got the first wave yet.
And this is the $1 million question that everybody is asking. Honestly, there's a lot of research I can tell you that it's ongoing because we're trying to figure out exactly what is happening. But one key factor that we have seen is we have a very young population. We know that the case fatality rate for people 60 and under is something less than 1%. So we find that you will not believe it, but only 3% of our nation, or the population of this country, is above 65. So you find out that a lot of the infections that we have tended to be mild, people are asymptomatic, and people tend to recover. So that's one factor that we can say, yes, this is one of the reasons that we're not seeing a lot of people dying from this infection. There are many other reasons, but to be honest with you, till we're done with all the research, we can't say that we have all the answers. Right now, we're just studying and trying to understand exactly why Africa has turned out to we've sort of escaped the scourge.
That would lead me to another logical question, which is, in other parts of the world, they talk about strains of COVID-19, the various strains of the COVID-19 virus. And with us reopening our international airports, that's another place that we've reopened, and people coming in and going out and coming back in. Do you harbor any fears about possible importation of any of these other strains that currently our health system has not had to deal with?
Okay, so let me explain something about strains. So before we can actually say that a virus has developed a new strain, there has to actually be research indicating that this strain, or what we're calling a new strain, is acting differently from what we've known before. And right now, we can't say that for the virus that causes COVID-19. What we have seen is there have been mutations in this virus, at least in 3 different places. There have been mutations. But have the mutations resulted in a dramatically different virus? We can't say that for sure. So when it comes to strains, right now, I would say we should withhold judgment for now till all research is done and we can say for sure there's a new strain. But right now, we do know that the mutations have not resulted in different strains at the moment. So that is not something that we should worry about. Obviously, we have to still continue the surveillance, all the processes that we've put in place for incoming passengers. We still have to put these things in place because transmission of this virus is what we don't want either way. So for now, let's withhold judgment on the strains.
Finally, I must ask you about your constituency now, and that is medical personnel themselves, those who are actually in the front lines treating COVID-19. Earlier on in the course of the pandemic, we had people, medical workers who were affected by COVID-19, who got infected. And some of those people were said to have probably not gotten the adequate training or not gotten enough PPEs and so on. Do you know, can you update us on what the situation is now? Is it better?
Oh, it's a lot better. It's a lot better. I mean, we had to undergo several infection prevention and control trainings. I had to do several myself. With more trainings, you learn to do better. So I can tell you that things have improved. It's unlikely that the rate of transmission to health workers is as high as it was at the beginning of the pandemic. Definitely, there's marked improvement.
All right, then. Thank you so very much, Dr. Blossom Madra-Fokwa. Thank you so much for your perspective and for your time on the program this evening.
Thank you so much. Thank you so much for having me. It's my pleasure.
The United Nations says the impact of the COVID-19 pandemic in Nigeria has exposed the vulnerability of its rural and urban populations to barely live above the poverty line. According to the United Nations, the socio-economic impact will likely unfold for years to come and risks halting and reversing even progress on poverty eradication, food security, as the country enters a new recession after 4 years. The disclosure was made by the United Nations resident and humanitarian coordinator, Mr. Edward Kilon, while briefing Governor Darius Ishaku on the priority areas of investment in Jalingo, the Taraba State capital. He adds that the decline in the number of confirmed cases is indicative of a decline in demand for testing and does not reflect a containment of the virus with ongoing community transmission.
The COVID-19 pandemic has been likened to an X-ray that has revealed fractures in the fragile skeleton of societies we have built. It has laid bare risks, including inadequate health systems, gaps in social protection, structural inequalities, environmental degradation, and the climate crisis, to be precise. But the pandemic has been vicious. It has preyed on the most vulnerable and wiped away decades of progress in poverty eradication and endangering the achievements of the Sustainable Development Goals. The world today is not the world we knew at the beginning of this year. We are seeing a world that is facing an epochal health crisis, only to compare to the greatest economic calamity and Great Depressions of the 1930s.
Let's go outside our shores, where the United States death toll from COVID-19 rose above 216,000 today, driven by a spike in new cases in the Midwest and Mountain West that are starting to fill hospital beds and squeeze healthcare systems. In the last 7 days, 16 states have added more new cases than at any other time since the start of the pandemic. This comes as President Donald Trump says he has tested negative to the virus. House Speaker Nancy Pelosi and Treasury Secretary Steve Mnuchin failed to come to a COVID-19 stimulus deal after another conversation. Maria Bird in Washington has more.
The White House released that the U.S. President Trump has tested negative for the coronavirus and is back on the campaign trail without a mask.
Went through it. Now they say I'm immune. I feel so powerful. I'll walk into that audience. I'll walk in there. I'll kiss everyone in that audience.
This comes as millions of Americans were hopeful that a vaccine would come before the November 3rd election. But Johnson & Johnson has temporarily paused its clinical trials as an unexplained illness in a study participant, delaying one of the highest profile efforts to contain the global pandemic. The delay in the race to a vaccine and the recent challenges with the U.S. coronavirus stimulus bill has caused a snap in a 4-day streak for the stock market.
Investors are frustrated that Washington can't seem to get its act together to give a package to the country, which is sorely needed, especially for small business, before the election.
While the coronavirus stimulus to the economy continues to be an area of political contention, millions of Americans are still faced with financial hardship, and the rates of COVID-19 contraction escalate at the highest rates in 2 months. From Washington, Maria Bird, Channels Television News.
Let's talk now to Maria. Maria is in Washington, D.C. Nice to see you, Maria. Welcome to the program.
Thank you for having me.
Let's start off with the last point with which you ended your report, which is the now not happening stimulus package. What's the problem?
Well, the problem at this time is that actually there's infighting within the Democratic Party, unfortunately. Nancy Pelosi has stood firm, the Speaker of the House, and said, no, we are not going to move forward with the bill that President Trump says he will sign. The reason for that is she's saying that there are many Americans that will still be suffering and will not be able to sustain with the $1.8 trillion bill. And she's asking for a $2.2 trillion bill that will allow for child care services, that will allow for many things that people don't think about with tax credits on for children, for having children, many things that will impact the everyday American. And so she's saying we're not going to just move forward. While there are other Democrats that are just hopeful to get something passed and something through because there are so many Americans that are waiting and have been waiting. But she says the Trump down bill is not one that will really impact and will allow for all Americans to be able to see a better day.
There was an expectation that somehow, from somewhere, it was possible that a vaccine could make its way onto the scene in time for the November 3 presidential election. That's gone now.
Yes, I think many people are not really holding hope in that, and it looks as if this will not make it before the November 3rd election.
President Donald Trump is back on the campaign trail, and he says he'd like to just dive straight in, now being immune from COVID-19. How is that going down?
Well, there are many Americans that are a bit confused. I think there are some that are very much in support, who have been in support of him for quite some time now. But there are many others, I think, that were on the fence that are questioning and asking, where's the sympathy? You think about the elderly population, and Democratic candidate Joe Biden has jumped right on the bandwagon with that and said that he has no sympathy and no commitment to the elderly community, who are the most potentially heavily impacted by COVID-19. And so I think that there are many Americans that are just wondering, what does he mean by I'm immune to it, when the studies have shown that you can contract the virus more than one time?
Postal ballots, absentee ballots, a lot of that is become controversial, partly because of COVID-19 and the fact that so many people don't want to physically go to the polling booths. Has that controversy resolved itself now?
Well, many people are still mailing in their ballots, but you are seeing some hesitation. And so you're still seeing the very long lines, even in early voting. I think there was a line in Georgia that was several hours long. I mean, you're seeing things that we haven't seen in decades in the United States when it comes to voting, because there is a limited number of voting polls because they are encouraging mail-in ballots. But again, people are scared when they hear stories such as their mail slots are being taken out of neighborhoods, that they're finding mail stacked on floors and not being ensured to make it to those Board of Election offices so they can be counted. They want their vote counted. So many people are standing in those very long lines, concerned about the actual validity and the ability to be able to successfully have a mail-in vote.
You've also reported that about 16 states have seen more numbers now than they had ever seen since COVID-19 started. So that's going on alongside the preparations for this November 3 ballot. Are people really worried about that in terms of how that could impact both the ballot and the economy?
I think people are concerned, but again, COVID-19, I think people are masking up, they're doing the social distancing, and they're standing in the lines. I think that their most important thing is they want to end the pandemic, and so they believe their vote matters to end the pandemic.
Well, I must also ask you about the battle between the states and the federal government over the economic recovery and the issue of jobs and all of that. How is that panning out? What's the update?
Well, the economic recovery is one that I think is slow going. We had a 4-day win streak with the stock market. We've now seen that today has been an awful day for U.S. stock market. We've seen where many people are still dealing with unemployment. Small businesses are still going out of business at high rates. And we're not seeing the number of jobs that I think they were anticipating to be able to really hit the markets and be able to get people back to work. There are many people that are still dealing with childcare issues, so can't necessarily get back into the workplace. And so there's a number of challenges. It's going to be a year or more before the U.S. is really able to tackle and get through what could actually get worse before it gets better.
Let's keep an eye on that. Thank you so much, Maria, for your reporting from Washington, and do stay safe.
Thank you.
French President Emmanuel Macron has declared a state of emergency while announcing new restrictions for Paris and 8 other cities as the country experiences a second wave of COVID-19. He made the announcement this evening during a nationwide broadcast. He says a curfew comes into effect from Saturday at 9 p.m. and will last till 6 p.m. every day over the next 4 weeks. This comes also as governments across Europe are introducing new restrictions to battle the new wave of infections. Here's our global update.
Prime Minister. With cases rapidly rising, the British government opted this week for a 3-tier system of local measures. The Liverpool area became the first part of the country in the highest category, requiring bars, gyms and other businesses to shut, perhaps for months.
If we do the regional approach that...
While responding to opposition leader Keir Starmer's demand for a temporary national lockdown, the Prime Minister says he will stick to this localised approach.
Let's try to avoid the misery of another national lockdown, which he would want to impose, as I say, in a headlong way. And let's work together. Let's work together, as he was prepared to do on Monday, to keep kids in school, who he would now yank out of school in a peremptory way, keep our economy going, and keep jobs and livelihoods supported in this country, Mr. Speaker.
Thank you, Mr. Speaker.
Meanwhile, Northern Ireland is to impose the strictest COVID-19 restrictions seen in the United Kingdom since early summer. The measures will see schools closing for 2 weeks and restaurants shutting for 4 weeks.
We fully appreciate that this will be a difficult and worrying news for a lot of people. The Executive has taken this decision because it is necessary, and we discussed the impacts in great detail, and we do not take this step lightly.
The British-run region has become one of Europe's biggest COVID-19 hotspots in recent weeks. In Spain, health centres in Madrid ramp up flu vaccination, while some shops and restaurants remain closed as the number of COVID-19 cases rise. Last week, the Spanish capital entered a state of emergency with the aim of containing one of Europe's worst coronavirus outbreaks. The socialist-led government invoked a state of emergency on Friday, October the 9th, to reimpose a partial lockdown for several million people in and around Madrid. Meanwhile, the Netherlands returned to a partial lockdown on Wednesday, with the Prime Minister Mark Rutte announcing the closure of bars and restaurants as it battles to control the coronavirus in one of Europe's major hotspots. The measures will last for at least 4 weeks, with a review of their impacts after 2 weeks. If they prove ineffective, officials warn that tougher restrictions may follow. Finally, Russia reported a new record daily high of 14,231 coronavirus cases on Wednesday, pushing its total number of infections to 1.34 million. The country's coronavirus task force says that 239 people died in the last 24 hours, bringing the death toll to 23,205.
That's our COVID-19 update for tonight. Do visit our website, channelstv.com, where you can take a look at some of the stories on COVID-19, as well as the safety protocols. You can also check there for stories on other topics, such as politics, business, and sports. We'll have fresh packages of COVID-19 update tomorrow at 6, and then again at 9. I'm Ladi Akere Doluale. Do continue to stay safe, and good night.